Hello, everybody. Welcome to episode 4 of the Moyamoya Diaries. This is Katie. It's been 3 weeks now since my surgery, so I thought I'd make an update video. As you can see, the biggest change from my last video 2 weeks ago is that I got all of my hair buzzed off. About a third of it was shaved off completely for the surgery, and rather than try and deal with a comb over for the next several months while my hair grew back, I thought I would just level the playing field and cut it all off completely. So I like how it looks. I certainly don't have to use nearly as much shampoo in the shower now when I wash my hair. And I do have to wear a hat now when I go outside because it is winter time. But other than that, it feels nice. I think I have a good shaped head for a buzz cut. And I had 14 inches taken off, I think is what my hairstylist said, when I got all the rest of my hair buzzed off. So I'm going to be donating that to Locks of Love once I get a padded envelope. I have all the hair bundled up into multiple ponytails in a bag, and I just need to get an envelope so I can send it off to Locks of Love. So there's one big change. Another big change is that my scar, hold on a second, let me look in my monitor so I can point out where the scar is now. I mean, you can see it. It's between those two fingers right here, going up between them. And it's looking pretty good. I got my stitches taken out 2 weeks ago, and every day since I got my stitches taken out, it's just looked better and better. The scar is getting thinner, and it's kind of sort of fading into my skin more and more each day. It's not as raised as it was when the stitches were first taken out, so that's awesome. Obviously, my hair is growing over it, so that's contributing to it being less and less noticeable, but I gotta say that the scar itself really does look better and better every day. So that's another good thing. Let's see, what else is going on? I haven't had to take any pain medication in the past 4 days. My neurosurgeon has me on 81 milligrams of aspirin. I'm guessing just to keep, the blood flowing easily through the blood vessels. So that's the only thing I'm taking now besides a multivitamin, but I haven't had to take any headache medicine now for, like I said, about 4 days. So that's good. My headaches were never horrible, right after the surgery. I mean, they were pretty painful, but they weren't like, I don't know, awful, knock me out, want to, smack my head against a wall kind of headaches. But they were bad. They were slightly migraine feeling, and migraines are awful, but they only kind of had that quality to them a little bit. And then when I would stand up, sometimes I would get like this weird zing kind of a headache that would last a few seconds and kind of then fade and just sort of like be a dull pain. And so I would take like Tylenol for it. But I haven't had to do that, like I said, for 4 days. So that's awesome. I can drive again. I couldn't drive for 2 weeks after the surgery, but my neurosurgeon gave me the okay to start driving after that. So my husband was driving me around before, and he was a total saint, taking me out if I needed something or wanted to do something. But I got to say, it feels really nice to just up and go if I want to. And the other big change is in terms of my symptoms. I have been feeling some of my symptoms that I had pre-surgery. If you watched my first video where I talked about the symptoms that I had that led up to my diagnosis and all the testing I went through, I talked about how my major symptoms were numbness and tingling on just the right side of my body. I had also felt muscle weakness and dizziness and vertigo before the surgery as symptoms. I think the dizziness and vertigo are considered symptoms, but I'm not quite sure because I do have migraines, like I said. So that might be more migraine related, but maybe migraines are also Moyamoya symptoms. I'm not sure. So since my surgery, I've had a little bit of numbness and tingling on the right side on my hand and my arm. Had a little tiny bit on my tongue one day, but that was only an isolated incident. But the numbness, the feeling of numbness is a really like weird, incomplete sort of a numbness feeling compared to what I had before the surgery. It almost feels like my body is on the surface trying to make my hand or my arm or my tongue numb, and then it tries for a few seconds, but it doesn't completely work. So then it's like my body just gives up and says whatever, and then the real feeling comes back into my arm, my tongue. So it's kind of weird. So that's a good thing. It's almost like the symptoms are lessening in their severity, if you will. So that's good. I shouldn't expect a full resolution of symptoms though for a while, like a few months, because it's going to take a while for the blood vessels to grow from those two sources that they laid on my brain in the surgery, and then take over the circulation on the left side. So again, not expecting a huge change right now, but it should get better and better as time goes on. So I see my neurosurgeon for my 6-week post-op appointment in 3 weeks, since I'm right in the middle of my convalescence right now. So I will make my next update video after that appointment. So thank you very much for watching. Everything's going well. Okay, thumbs up all around. I'm feeling good. So thanks for watching, and I'll see you guys in 3 weeks. Bye.